years like that. People walking around with this. People are always, it's the age of social media. Cell phone down, computers, cars, everything. And so what I'm gonna do, I'm gonna have you pinch your shoulder blades together like that. Let's take different. There we go. I'm actually gonna do pretty decent stretch right in the middle here. I'm gonna stretch. Keep those shoulder blades pinched.
I think I should have been doing what you were doing.
Good. Alright, relax. It's so quiet. No, it's like they're paying attention to me. And this tape is not as sticky, it's for very minor injuries, but I'm just using it to demonstrate, and it'll be less painful when I take it off of him. So I'm being nice to Joey, because I just made fun of him. Okay, so I do that one. Right here.
So you said some is for minor and then some is for.
I tend to use rock tape for almost everything. Because I can manipulate it and I like how sturdy that stretches. But this is still good tape. This K tape and Kinesio tape is still good tape. And I would use that for like minor injuries, not chronic problems, not something that's been there for years, but like say someone tweaked their thumb or something like that. And that happened a couple weeks ago, but they're still having pain. It wouldn't be an acute, it wouldn't be an acute issue that I would, like if it happened yesterday, I'd use the strong tape. But if it happened a couple weeks ago, they're still having that little bit of pain and they feel like it's compensating, then I'd use this kind of tape.
Okay.
Because some patients don't tell everybody, like tell their doctors everything. And so it's like 2 weeks later, you find out something happened, then you gotta.
Because we're usually used to going to doctors that only want to hear one thing at a time.
No, I want to heir everything. I want to know what's going on. But yes, I understand.
You have to wait 3 weeks before you can tell us about the other thing.
Well, heck, this first time I don't really know about.
Yeah, pick which one hurts the most, and that's the one we're looking at.
All right, move around a little bit. See how it is. It's a little lopsided and ugly. Don't judge me. I'll make it prettier.
Can you turn so we can see it?
And so what this is doing is it's holding his head back. So as he tries to move his head forward, you can feel that tension as a reminder. As he tries to pull his shoulders kind of forward, you feel that tension here as a reminder.
That's uncomfortable.
Yeah, it is uncomfortable, but if you work out all the time, so you have to have that range of motion. However, if you sit at a desk or in front of your computer for like 8 hours a day, this would be perfectly fine. Like it's not gonna be like uncomfortable to move around. Like, but it's supposed to give you a little bit of, oh, that's not right.
And what about for like mid back or low back? Do you
Low
do
back?
it cross the same way like you did that top?
Nope. For low back, depending on what's going on, if your pain is coming from here, I would tape it differently, but since he's exposed here, I would have him arch his back, tape pretty tight right here, so as he starts to slouch, kind of bend forward, and lose that curve, it's a reminder, and it'll pull his back like that.
So when you be pretty tight, like no stretch, 10% stretch?
Pretty tight 70, like you don't want him to not be able to sit, and so probably 50% stretch is all you'd need. Because you want him to still be able to move and have full range of motion, but you don't want him to be comfortable slouching. You want it to be like, oh, that's weird, and make him straighten up.
Have you seen the workout t-shirts where they tried to market the same thing, where it was a really tight fitting shirt and it'd pull you back? See any of that?
I have not, but that sounds really interesting and
Yeah,
entertaining to me. It sounds like a corset.
For guys, it kind of was.
Of course.
It was a really tight